According to the American Cancer Society, lung cancer makes up almost a quarter of all cancer deaths. So what are the symptoms of the disease, and are those symptoms indicative that the disease is advancing? Well, joining us to discuss this more is Dr. Sudeep Siddhappa Malashappa, the attending physician at UMass Chan Medical School, Bay State. Doctor, thank you so much for joining us today.
Thank you for having me.
Absolutely. So what are the main symptoms of lung cancer?
You know, lung cancer is the second most common cancer in the United States after the prostate cancer in men and breast cancer in women. And typically the most common symptom with the lung cancer is the cough. Can be present in up to 50 to 75% of people. The other could be chest pain, shortness of breath, or they could also experience some blood in their cough, or things like, hoarseness of voice. But the most common symptom, what we see is cough.
Okay, and I know that a lot of people think that you talk about lung cancer, you think about people who smoke, but can non-smokers also get lung cancer?
So, yes, non-smokers can get lung cancer, but smoking is associated with almost 90% of lung cancers. But other things like exposure to asbestos, radiation could also cause lung cancer. But those other factors causing the lung cancer is pretty minimal compared to smoking.
Okay, and so what are the ways other than not smoking to prevent lung cancer?
So the most important way is quit smoking. And just to give you statistics, somebody who quits smoking, their risk of lung cancer decreases by 5 years, and by 15 years it's as low as 80 to 90% compared to who's actually smoking. Obviously, people who you are in a high risk occupation like plumbing or electrician, they could use appropriate equipment to avoid exposure to asbestos, things like that. So we also, because it's the most common cancer to result in death, the United States Preventative Task Force have put forth recommendations which include screening for lung cancer, which can detect it sooner, and which involves doing CT scans every year for somebody who's at high risk, which include somebody who's smoking at least 20 pack a year, in the sense of a pack for a year for 20 years, and who are between 50 to 80 years of age. So they could undergo CT scans every year to help detect the lung cancer sooner, and we could be taken care in an appropriate way.
Okay, all right. Well, Dr. Sudeep Siddhappa Malashappa, thank you so much for joining us. It's all the time that we have, but thank you for educating us. We appreciate it.
Wonderful. Thank you for having me.